I think it was March 20th or thereabouts, the municipality, the mayor issued what we call a hunker down order, which requested that people stay at home as much as possible, stay socially distant, work from home as much as possible. Um, and he shut down um, stores and restaurants, indoor spaces. He shut them down for a while to slow the spread, to flatten the curve, and also allow us the opportunity to build up the resources that we were afraid that we would be needing in terms of supplies and hospital capacity. And so we did that for, I think, 2 or 3 weeks. And then we created a roadmap to reopening. And all of this is on the municipal website. And it's all in a multitude of different languages as well. So from the hunker down order, we implemented some more relaxing policies that allowed for indoor dining that was properly spaced. We allowed for stores to open, but at the same time, the mayor imposed a mask mandate, so required people who were in indoor spaces to wear masks. And that lasted for a while, that status. And then in August, very early August, we went back a little bit to a revised hunker down where we closed indoor dining and bars because we had started to see spikes in numbers, but also lower capacity in healthcare. So we just finished with that, and we're back to that middle status quo where we still have a mask mandate. We still are urging people to stay home as much as possible, socially distance, wash your hands, and take very precautionary, to be very cautious and minimize your socializing. But we have reopened restaurants at half capacity, and we have reopened bars at half capacity. And we still do have some capacity restrictions on indoor gathering. Well, it affected it pretty dramatically, like everywhere else. Alaska is highly dependent, especially in the summertime, on tourism. And because tourism basically stopped, we have a lot of local businesses who are really suffering as a result. We also have a big commercial fishing season, and we've had a series of outbreaks in canneries and fish processors, so it's impacted that as well. The closure of some businesses, or that they minimize or have the people that can come to those businesses, like in the hospitality sector, has also had a negative impact. So we have small businesses who are suffering pretty drastic impacts. Well, like many other places, in March when the pandemic hit fully, we closed in-person schools. So we went to online school for both K through 12 education, but also the universities here. And while we were hoping to be able to open back up to in-person schooling, so far in Anchorage, we have not. So the school district has a formula for when they will open to in-person school, but because of the spike in cases that we experienced this summer, they decided to stay remote, at least for this first quarter. And so we're all waiting to see, but in the meanwhile, all students are at home. We have started after-school sports though, so we have sports available to students right now. But for example, our son is a high school student, and he's taking classes every day online, 4 hours a day for 4 days a week, but he's only taking half the number of classes that he was before. And so they'll switch at the quarter. So they're condensing it, they're changing the delivery format, and it's nerve-wracking, but we'll see how it works. Well, we're pretty lucky up here in that I think we just yesterday or the day before hit our 40th death, which is not lucky, but our numbers have been pretty low in terms of COVID related deaths. So for that, we're grateful. One is too many, of course. And then we've got our hospital capacity, I think, is back at an all right space so that we're not so concerned about that. But I think where the real concern is for health is in, of course, with everywhere else, with elderly populations, with vulnerable populations. I think increasingly we're seeing that age is not necessarily the only factor in making somebody vulnerable. So I worry about school kids as well. Uh, we're not in a rural area in Anchorage, but we definitely, what happens in rural Alaska has an impact in urban Alaska. If people get sick in rural communities, they will come to Anchorage for medical help. And so we're very, very keenly worried about transmission in rural communities, which don't have as many health facilities as the hub communities or the urban communities. So we're keeping a very careful eye on what's happening throughout the rest of the state as well. And we take that very seriously. Anchorage is also a point of transit for like the fish processing workers. They come through Anchorage and then go to villages. And so we are keeping a very watchful eye on our own practices here to make sure that we're not adding to the potential threat to the rural communities. We had outbreaks. It was difficult because, again, they needed to go to a place to quarantine. And so they came to Anchorage to quarantine. And I think just, people are just generally concerned when you have infected people. And so we just needed to make sure that we had space and a place for them to be safely for their quarantine period. Well, initially, everything was in short supply. We had shortages of personal protective equipment. We had food shortages. Services were also stressed because, again, when you're concerned about people's health, you don't want to we had to worry about frontline and people who are not only in the healthcare industry, but in the grocery stores and in the gas stations. So it definitely had an impact, and it took a lot of work and a lot of effort to make sure that we were able to eventually get enough PPE supplies. Eventually, to the food became more and more plentiful on our shelves. But for a good month or 2 months, there was no flour. I mean, it wasn't anything we couldn't live with, but it was really interesting to see the very, very empty shelves in the stores. It was a reminder of how vulnerable we are. One of the outcomes, not for food necessarily, but for the PPE, is we started to produce our own. And I think that could hopefully be one of the silver linings that comes out of all of this, is a recognition that we need to shorten our supply chain, make sure that we're able to produce more local products that we need, and to reduce our vulnerability to things that are beyond our control, like pandemics or earthquakes or what have you, anything that would cut off our supply chain. We did, yeah, not to the degree that it satisfied everybody, but we were able to create some pretty innovative face masks. And we worked together with we have an innovation team at the city, and then with the local university and some healthcare providers to produce masks. We've had the same issues as everywhere else around the country in terms of disproportionate impacts on communities of color. I mentioned indigenous populations in terms of village communities, but we also see that here right now. We're experiencing some pretty serious outbreaks in our homeless shelters. So we're very, very worried about that. we also have, again, made sure that we have materials and information that is provided in, I think, about 20 different languages. So we have taken great care to work with the different linguistic communities that we have in our city to ensure they have access to just information, first of all, but secondly, to be able to get the resources that the city is making available. For example, rent relief, small business loans, food, health information, education information, and things like that. And I would urge you to look at the municipal website. If you go to muni.org, and if you hit the COVID button, it will take you to a page where there are all of our language resources. And there's a wide variety of them. Well, so we are also working with the school district. Well, the school district has made sure that students have access to iPads and to internet. And so while if you have a student in your household, you can have access that way. We're also working with libraries to try to figure that piece out, but you're absolutely right. Not everybody has internet access. It's a huge problem. So they get access to information through friends and networks as best as they can. I think we're never letting, I think that we cannot afford to loosen our tension. I think that we are always worried about people's health and well-being. And during this crisis, we're very worried about the disproportionate impacts of COVID on poor communities and communities of color who have heightened vulnerabilities to the disease. We're worried about people not being able to get access to their basic needs. So I just don't think we can afford to be at all relaxed in our approach. And that said, I do think that a lot of our approach is working in terms of keeping some numbers down, keeping the transmission rates down. But again, we can't let up. It's not a time to relax and rest on some of these successes. So do I think they're working? Yes, but it takes a lot of fortitude and strength to make sure that people are still doing what they need to be doing and are able to get access to basic needs. In Anchorage, probably a little less so, but from the stories I've heard, the villages have been incredibly quick to respond because of the 1918 pandemic, and so have shut down and been very, very eager to shut down. In Anchorage, unfortunately, what we've seen is that people are politicizing a disease. And so we've got a lot of debate about the disease that is not really warranted because it's a disease, it's not a political issue. And I think that that is an area where the memory of having lived through a pandemic is probably of great benefit in rural communities because it's not political, it's a fact. So the willingness to shut down if one person gets infected is the exact right response. And frankly, I think that what I've been hearing at any rate about rural communities is there's no debate about the pandemic and the impacts. And so it's you just shut down. Yes, we've had a fiery debate about masks and about the need to close down businesses, and people have gotten incredibly hostile with one another. Our biggest lesson is that when it comes to disease and when it comes to science and when it comes to facts, there, when you inject politics and debate into things that are just true, it compromises everybody's health and safety. And what has been missing in our state and in our federal government is leadership and a consistent message from the top. And the pressure that that puts on a local government who is willing to act in the interest of saving life and livelihoods, it puts an inordinate pressure on a local government that doesn't have the capacity to act by itself. The biggest lesson is that we need partners at all levels of government, and between scientists and politicians and decision makers. We need people to come together around facts and understand what the impacts could be in order to hopefully curtail the worst of those impacts. So the biggest lesson is that when you politicize a pandemic, there is incredible harm to lives and livelihoods. But it has really been difficult for a local government to take that burden on their own shoulders all alone. And I think that's happening around the country in a lot of different areas where local mayors are acting in the best interest of their community to keep people safe, but without any federal guidance or federal consistent leadership, it is really difficult. There was one moment, just as a little story, you introduced me as the First Lady. I'm married to the mayor of Anchorage. And he and I, one night, late at night, were sitting in our basement together, making a series of telephone calls to whomever we could think of to try to figure out how to buy personal protective equipment from Korea or from China. And I looked at him and said, this is absolutely ridiculous. Like, why are we hiding in our basement trying to figure out how to make a massive purchase of basic equipment from overseas? Where is our federal government? Where is our state government in this? And it was just two little people in a basement in the middle of Anchorage, Alaska, trying to figure out how to solve these big problems. To me, that was really illustrative of how difficult it is when you don't have partners who are capable of addressing the different pieces of this problem.
Thank you so